Hey guys, welcome back to Mediverse Atlas. Hope you all are doing fine. So now let us start with the anatomy of head and neck. So our first lecture will be on the topic, the anatomy of scalp. So let's get into the topic. So scalp, it is a soft tissue which covers the cranial vault. So this is the simple basic definition of scalp. Now let us talk about the extent of scalp. Now the scalp anteriorly it is extended up to the supraorbital margins or the superciliary arches, whereas posteriorly it is extended till the external occipital protuberance and superior nuchal lines, whereas laterally it is extended till the zygomatic arch and external acoustic meatus. Now let us try to appreciate the same extent in this diagram. So anteriorly the scalp it is extended to the superciliary arch or the supraorbital margins, whereas laterally it is extended till the zygomatic arch and the external acoustic meatus, whereas posteriorly to the superior nuchal line or the external occipital protuberance. So this is the extent of the scalp. Now let us talk about the very important subtopic, that is the layers of scalp. So totally there are 5 layers present in the scalp. Now it can be remembered through a mnemonic scalp itself, SCALP. S for skin, C for connective tissue, it is also known as superficial fascia, and A for aponeurotic layer or the epicranial aponeurosis or gallia aponeurotica. So this aponeurotic layer it is known as the epicranial aponeurosis or the gallia aponeurotica. Okay, now L for the loose areolar tissue and P for pericranium. Now let us study each and every layer in detail. Now let us study about the first layer, that is skin. So before studying them in detail, now let us look at the diagram of these layers. You can represent these 5 layers in the exam through this diagram. Okay, so this is the skin, this is the superficial fascia, this is the aponeurosis or the aponeurotic layer, so this is the loose areolar tissue, and this is the pericranium. So till here it is the layers of scalp. You can draw this in diagram, or else you can draw this also if you want. If you have time, you can definitely practice this also. Now let us study about each and every layer in detail. So first let us study about skin. The skin is hairy due to the presence of hair follicles, and it is adherent to the epicranial aponeurosis. That is, skin it is firmly attached to the epicranial aponeurosis, and in the skin there are numerous sweat glands and sebaceous glands present. Now I can definitely say that sebaceous cysts are more common. Why? Due to the sebaceous glands are numerously present on the skin. So this is one of the clinical point related to the skin. Now the second is the superficial fascia or the connective tissue. Now the superficial fascia it contains blood vessels, and this provides a proper medium for the passage of vessels and nerves to the skin. Okay, you can appreciate this point in this diagram. You can look that the superficial fascia. So this is the, so I'll just zoom it. So this is the skin, this is the skin, and this is the superficial fascia. This superficial fascia, as you can appreciate, it is rich in the blood vessels. So now what is the clinical point rated here? So if there is any wound here, so suppose if we have a wound here, so we have a cut here, then it will bleed profusely. Why? Due to the presence of numerous blood vessels. And one more important point here is these blood vessels they are adherent to the dense connective tissue, like they are fixed by the dense connective tissue. So it is, the vessels cannot retract to control the bleeding. Normally our vessels they retract or they constrict to reduce the bleeding, but in the scalp or in the superficial layer of scalp what exactly happens is these vessels are densely fixed, as they cannot retract and they bleed profusely. The same thing I have written here. So as there are many blood vessels, scalp won't bleed profusely, and these vessels are fixed in the dense connective tissue and cannot retract. Now before entering into the third layer, I just want to give a small MCQ point here. So majority of the scalp roof, which is known as clavaria, it is formed by the parietal bones. Of course a simple basic question, but you need to know. Okay, now let us talk about the epicranial aponeurosis. This epicranial aponeurosis is important for attachment of one muscle called as occipitofrontalis. Now this occipitofrontalis is a combination of two muscles. Those are, from the anteriorly we have frontalis, from posteriorly we have occipital muscle. Okay, now what is the importance of knowing these muscles? Before knowing the importance of this muscle, we have to know the nerve supply of this muscle. That is only important here. So this frontal bellies from the anterior side, like the insert on the epicranial aponeurosis, these are supplied by the temporal branch of facial nerve. Okay, so these are supplied by the temporal branch of facial nerve. Now whereas these occipital bellies, these are supplied by the posterior auricular branch of facial nerve. Okay, these two muscles are supplied by facial nerve itself, but the branches differ. Look carefully, frontal bellies they are supplied by the temporal branch of facial nerve, whereas these occipital bellies they are supplied by the posterior auricular branch of facial nerve. So you have a chance of asking the nerve supply in MCQs. Now one more important note point which we have to remember here is the first three layers of scalp are movable. Okay, so they are movable and they are called as surgical layers, and they are also known as scalp proper. Okay, now let us talk about the fourth very much important layer, that is the loose areolar tissue. Okay, now this loose areolar tissue it extends anteriorly into eyelids, as frontalis muscle has no bony attachment. Okay, this frontalis muscle they have no bony attachment, so this loose areolar tissue it extend into the eyelids. Okay, now this loose areolar tissue it is known as dangerous area of scalp. At the same time it is also known as the safety layer of scalp. Okay, so this is a paradoxical thing. Okay, it is the dangerous area of scalp and the safety layer of scalp. Now let us try to know why it is known as the dangerous area of scalp. Because emissary veins connect the veins of this layer to the dural venous sinus, so infection may easily spread and cause formation of thrombosis. I know you have not understood anything, but try to remember this dural venous sinus. We'll be studying the dural venous sinus in detail in the next coming videos. Okay, so there are some veins called as emissary veins. So these veins connect the vessels of this layer to the deeper veins which are present near the brain. Okay, so it just gives a passage. These emissary veins they connect to the dural venous sinus. This dural venous sinus is very important. So infection can be easily spread from the emissary veins to the dural venous sinus. Okay, so infection is easily spread and they cause the formation of thrombosis. Okay, I hope you are clear. Just remember danger area of scalp. Why? Because of the presence of emissary veins which connect the superficial veins or the emissary veins to the dural venous sinus. Now it is paradoxically again known as the safety layer. Why this layer is known as safety layer? It is due to the presence of this layer blood spreads and prevention of the brain reduces. Okay, so this compression of brain is prevented here because of this layer loose areolar tissue. Of course the name suggests it's loose, so the blood easily spreads. It is not stagnant. Blood does not stagnate here, so it spreads and compression of brain is prevented. So this is known as safety layer. Now the fifth layer, and it is known as pericranium. It is the periosteum of skull bones and it is loosely attached whole except at the sutures. So it is not that much important, just try to remember. Now let us come to an important segment, that is the arterial supply of scalp. This arterial supply of the scalp can be studied under two headings. First, in the front of the auricle, next the behind the auricle. In front of the auricle we have three important arteries. See, you have to remember all these things. Like if you keep revising you will definitely remember these things. Okay, in one shot we cannot learn everything, so we need to refer daily or weekly, like regularly we have to revise all these things so that it retains in our memory. Now let's get back. In the front of the auricle we have three arteries. These arteries are supratrochlear, supraorbital and superficial temporal. Remember, trochlear, orbital, temporal. Okay, Now let us appreciate the same things in this diagram. In front of the auricle, that is in front of the ear, we have supratrochlear, supraorbital and superficial temporal. Okay, now behind the auricle we have two arteries. These are posterior auricular, of course it is posterior to the auricle, so it is posterior auricular, and the occipital arteries. Okay, these occipital arteries, we have again 2-3 arteries in these occipital arteries only, and these occipital arteries, they are tortuous, that is they are in a snake like pattern like this. We can appreciate in diagram, I'll show you. So behind the auricle we have the posterior auricular artery and the occipital artery. See, you can see this course of this, it is tortuous like this, like a snake. So this structure, it is known as tortuous. And in the human body we have other tortuous arteries also. It is very much important to know other tortuous arteries also in the body, because in the viva examiners, they frequently ask the tortuous arteries present in the body, so we have to study them. So what are the other tortuous artery? Facial artery, we have occipital artery, we have cavernous part of internal carotid artery. I know these sound somewhat odd, but till your course completes, you'll be familiar with all these arteries. Okay, don't worry, just try to listen, that's it. So we have facial artery, occipital artery, cavernous part of internal carotid artery. We have coronary arteries which surround the heart. We have splenic artery at spleen. We have left gastric artery at stomach. We have uterine artery obviously at uterus, and ovarian artery surrounding the ovaries. So these are some important tortuous arteries present in our body. Now let us study the venous drainage of scalp. See, I suggest you people to study the venous drainage of scalp here only, because what happens is you will be studying the same thing under a different heading. You will be studying the same topic as the venous drainage of face, so better to study here only. Okay, of course it is little bit somewhat tricky, but trust me, if you revise it once or twice, you will definitely ace it. Okay, now let us talk about the venous drainage of scalp. Venous drainage of scalp can be studied as superficial drainage, deep drainage and the dipolic veins. So first we'll talk about the superficial drainage. We have studied the arteries of supratrochlear artery, the superficial temporal artery. Similarly here we have supratrochlear vein and supraorbital vein. Okay, like veins follow arteries, right? If the artery is named, the vein also will be named the same. So the supratrochlear vein and supraorbital vein, they combine to form the angular vein, and this angular vein, it continues as facial vein and drains into the internal jugular vein. You can appreciate this thing is diagram. The supraorbital vein and the supratrochlear vein, they join to form the angular vein, and angular vein, it continues as facial vein, and facial vein finally drains into the internal jugular vein. Okay, now in the superficial drainage only we have another some important veins. So superficial temporal vein, it combines with the maxillary vein to form a retromandibular vein, and this retromandibular vein, it has two divisions, anterior division and posterior division. This anterior division, it drains into the common facial vein, and the common facial vein finally drains into the internal jugular vein, and whereas the posterior division, it drains into the posterior auricular vein, and the posterior auricular vein, it drains into the subclavian vein. We'll appreciate the same thing in the diagram. So what did we study? We have two veins, the superficial temporal vein and the maxillary vein. They join to form a retromandibular vein, and it has anterior and posterior divisions. So this anterior division, it combines with the common facial vein to drain into the internal jugular vein, whereas the posterior division, it combines with the posterior auricular vein and it drains into the subclavian vein. Okay, so this is about the superficial drainage. Now deep drainage is by emissary veins, and they connect the emissary veins, we have talked earlier, as they form connection between superficial veins and deep veins to equalize pressure. So as there is a connection, so there is a more chance of the transmission of infections. Why? Because these emissary veins are valveless and they have bidirectional flow. Okay, so these are the main reasons. Emissary veins, they connect the superficial veins and deep veins. These are valveless and they have bidirectional flow, and Due to these properties, there will be easy transmission of infections. Next, we have something dipolic veins. So these dipolic veins, the work of these dipolic veins is they carry the newly formed blood cells into the circulation. Okay, now the nerve supply. Nerve supply also can be studied under two subheadings, that is in front of the auricle and behind the auricle. And nerve supply consists of the sensory nerve supply, which supplies the sensation, and motor supply, which is for actions. Okay, so first you don't need to study the whole thing. The things which I have highlighted, those are more than enough. Okay, first in front of the auricle, what are the sensory nerves? Sensory nerves in front of the auricle are supratrochlear, supraorbital, zygomaticotemporal, auriculotemporal, and we have one motor nerve, that is temporal branch of facial nerve. Remember temporal branch of facial nerve, it supplies the frontal bellies. We have studied now, it supplies the frontal bellies. I hope you guys remember. Okay, and behind the auricle we have, what are the sensory nerves? We have great auricular nerve, lesser occipital nerve, greater occipital nerve, third occipital nerve, and the motor nerve is the posterior auricular branch of facial nerve. Now just comment guys, posterior auricular branch of facial nerve is supplied by, like, which muscle? It supplies which muscle? Just comment in the comment section. Okay, we'll appreciate the same thing in this diagram. Diagrams are much important. Okay, so in front of the auricle we have the supratrochlear nerve, supraorbital nerve, and the zygomaticotemporal nerve, and the temporal branch of facial nerve, which is motor, and we have auriculotemporal nerve. We have posterior to auricle, or the behind the auricle, we have the great auricular nerve, the posterior auricular nerve, lesser occipital, greater occipital, and the third occipital. I hope you guys are clear with the nerve supply also. And finally, clinical anatomy. I have covered the most of the clinical points in the above things on, like dangerous area of scalp, the sebaceous cyst. We have some other important things also to talk about. So first we'll see what is cephalhematoma. So this cephalhematoma, it is a subperiosteal hemorrhage. That is beneath the periosteum there is hemorrhage. Okay, so this is mostly occurred in newborns due to difficult childbirth or the birth trauma. And what is the most common site? Obviously the parietal bone. And as periosteum is tightly adherent in sutures, the fluid does not cross the suture lines. Okay, I hope you are clear with this cephalhematoma. And another one is called the safety valve hematoma. The safety valve hematoma is the collection of blood in the loose areolar tissue. We have studied that the loose areolar tissue is loose, as the name suggests, so blood spreads, it is not stagnant. So as this the spread of blood, it prevents the compression of brain. Okay, so that is the most important thing to be noted. So this is all about scalp. Thank you for watching this video. Don't forget to follow our Instagram and Telegram channel, subscribe, like, share, and once again thank you. Have a good day. Bye.